Okay, so why do I teach what not to do? So in our videos, sometimes I teach what to do, teach what not to do. As a former firefighter paramedic, you're taught first aid procedures to apply in different situations. So choking, cardiac arrest, things of that nature. And then they're age appropriate. So whether it's an infant, whether it's a teenager, or whether it may be a toddler, right? So different ages, different sizes of people require different amounts of force and different techniques to be used. It is equally as important to know what not to do as in knowing what to do. So the other day I posted a short, it riled up quite a few people on never applying abdominal thrust to a choking infant who is conscious under the age of 1. So you never want to apply abdominal thrust because it can cause very severe life-threatening injuries such as organ rupture, broken ribs, diaphragm perforations, intestinal, lots of internal organ issues. But it's equally important to know why we don't do those and what techniques to not apply in certain situations. So a choking infant under the age of 1, we never apply abdominal thrust because you could cause organ damage. That's an adult or child technique. So somebody over the age of 1. It's important to know what to apply, but also when and what not to apply because you could cause catastrophic injury to them. Same thing with a choking infant who's conscious. So typically with a conscious infant, we're applying back blows and chest thrusts with 2 fingers or heel of the hand, depending on which organization you're certified by. Those are the appropriate techniques for an infant under the age of 1. However, if you have a choking toddler, a child, so someone over the age of 1, so that would be children and adults over the age of 1 who are conscious and choking, we're not going to do those inverted 5 back blows, then rotate them over and do those chest thrusts like this. That's an appropriate technique for infants, but not for children or little, and not definitely not for toddlers, not for children and not for adults. The reason why I would tell you, or I do tell you and teach you in videos what not to do, is because those techniques either aren't going to be adequate for that emergency or they could cause catastrophic injury to that person. So with the infant, we talked about abdominal thrust causing internal abdominal organ issues. It could also happen with a toddler, but when we talk about back blows, right, inverted back blows are appropriate for an infant. However, they're not for a toddler because the toddler, one, is probably too big, or the child, that if we try to invert that child to provide back blows, we may not be able to control the child, which would make our back blows ineffective. So proper technique for an infant. You should not be doing back blows like this to a toddler because you can't control them based on their weight. On top of it, these inverted back blows, you could drop them on the head and may not be adequate as far as a back blow for a child. So proper technique, same thing. You should never do blind finger sweeps. So when we're talking about choking, the research overwhelmingly supports never do a blind finger sweep. So you never want to stick your finger into their mouth and try to sweep something out if you can't see it. So blind finger sweep. Never do that for a child, for an infant, child, or an adult. Perforations from adults' fingers perforating into the oropharynx or up into the the airway in the back of the throat here. So you don't ever want to do a blind finger sweep. Could cause injury, may not be effective, and could make the choking situation worse. So there is a place and time for knowing why you shouldn't use a certain technique. When it comes down to even the Good Samaritan, if you are so far outside of what a standard of care would be for first aid provided during an emergency, you could be civilly or criminally liable by applying a first aid technique that is not within a general scope of practice or standard of care within a basic CPR class. So teaching you guys what not to do if you are doing super egregious and negligent care to somebody that's outside the scope of Good Samaritan. So it is a really good idea to understand what you can and can't do. That's why throughout my choking first aid course and community, we stress, hey, you should be taking a quality CPR class with a qualified certified instructor with equipment that has feedback mechanisms in it. So like right now, I can turn the baby's diaper on. When I'm compressing, this is not the proper technique, but as I'm compressing, you can see these lights change. If I have those 2 additional green lights, that shows I'm at the proper rate. If I'm going too fast, I have a yellow light. If I'm not compressing enough or fast enough, the turn light turns red. Red kind of means dead. So make sure you're taking a class from somebody who has quality mannequins. They have feedback devices. So that way you can understand, once again, what not to do, right? So Am I using two hands to compress an infant's chest during chest compressions? No. It's important to know why you shouldn't do that, because two hands from an adult to an infant in cardiac arrest while doing chest compressions could absolutely crush the baby. Now, it's not uncommon to break ribs when performing CPR, but that's why I say with an infant, you're using the two thumb circling technique or the heel of your hand for those chest compressions, going for about 1.5 inches of depth for those 30 compressions. With a child over the age of 1, it's important to know what not to do. If this child's around 4 years of age and I'm using an adult chest compression on this toddler who's 4, I could probably do way more damage than is acceptable when providing first aid for a cardiac arrest. So with a child, probably up to the age of around 9 or so, it also depends on the first aid provider. You're typically using the heel of one hand for younger children. As they get bigger up towards puberty, around the younger teenage years, that's when you're going to transition into probably two hands. But once again, it depends on the size and weight of the person who's injured in cardiac arrest, in the sense, and the size of the person who's rescuing that person. So don't use the adult technique on a child because you could injure them. Don't use the adult technique on an infant. So I think I'm conveying my point. There are equal reasons as to know why and as to know what you should apply and what you shouldn't apply. I'll leave you guys with this. There was somebody in a neighboring jurisdiction who intubated an infant, cardiac arrest, took an adult-sized endotracheal tube to put down into an adult's airway. Tube ends up down here roughly in the trachea, supports their airway, and protects the airway so we can ventilate them during cardiac arrest. This person intubated an infant with an adult-size ET tube. This infant's airway is probably a quarter the size of my pinky, roughly speaking. That person used an ET tube roughly the size of one of my fingers in diameter to intubate that kid, totally tore the airway apart and open and killed the child. The child's already in cardiac arrest, but now they have zero chance of survival because their throat was torn apart. And that was pro lawyer teaching how to keep yourself safe and why it is important to apply the proper care and to be aware of what is wrong and not to do, so that you don't, one, put yourself in a criminal or civilly liable situation, but more importantly is that you don't kill the person you're trying to provide care for or catastrophically injure them. Now, if you are applying the proper techniques and the proper general standard of care in an emergency, once again, you're covered under Good Samaritan. So if any injury occurs, you're protected because you're doing those basic things accepted during those emergencies. I'll go over Good Samaritan in another video, but very important to know what not to do and when to not do those things and what to do and how to do them. And that's why I created the chokingfirstaidcourse.com. I hope this answers some questions on why, one, you should not do abdominal thrust on an infant and why I do teach what not to do, and I'll continue doing it. So thanks a lot, guys. Take care.